I studied engineering in college, and I was always fascinated by the prospect of new technologies that could help us better diagnose or better treat patients. Much in the way that an engineer thinks through a problem, a cardiologist, and especially a heart failure cardiologist, goes back to understanding the basics of how the heart works and what medications or devices might help that patient in the moment. I'm an advanced heart failure and transplant cardiologist, which means I see patients all across the spectrum with congestive heart failure, those who may be new in their diagnosis or have minimal symptoms, and even those who are sickest in the intensive care units, help treating patients with medications or, when the situation calls for it, in treating with advanced therapies like transplantation or the mechanical surgically implanted pump called the LVAD. I tend to see patients that have both acquired comorbidities, that have high cholesterol, diabetes, hypertension that may have led to their disease, or others who maybe got this disease, heart failure, without any of those risk factors, which can be even more scary for many of these patients. I'm trying to create a judgment-free atmosphere and trying to really learn about you and your condition. Heart failure at its essence is heart muscle dysfunction, and that can be either weakening of the heart muscle, sometimes stiffness of the heart muscle. But for patients to be able to understand that and why some of the medications we discuss, why they work to treat their condition, I find that very impactful in collaborating with the patient to really come up with a good treatment plan moving forward. One area that I'm particularly interested in within heart failure is genetics and inherited heart diseases. Whenever I hear that someone may have a family history of heart disease or of heart failure, I like to explore that in detail. We may be using genetics to guide what is the right medical treatment for the right patient at the right time, and to really be able to personalize care. I try to create the most collaborative environment possible. I try to really speak to the patient as if they were my friend, neighbor, or family member. I find it so rewarding to see that breath of relief when a patient finally understands something about their heart disease that was confusing or scaring them for a long time. I'm actually a native of Cleveland. I was born and raised in this area, so very thankful to be able to come back and take care of many patients in my hometown. But also, I am fortunate to be able to care for people all across the state, all across the country and world, really, who come and seek our care.